Good evening, and thanks for joining us on Pix 11 Facebook Live on this Monday night. I'm Mary Murphy, and I'm going to talk about something that a lot of people are discussing right now, plastic surgery. Should I not? Specifically, plastic surgery in the Dominican Republic. There have been several deaths there just in the last month, and some of the victims came from New York City. Let me talk first about Manuel Nunez. In mid-June, he died. Apparently, it was involving respiratory distress. He was getting a liposuction at a clinic in Santo Domingo, and he was a New York City waiter. Did not make it home, did not make it out of the Dominican Republic after that procedure. There have been other cases. One of the women talked about in early June was a school teacher from Alabama, 45 years old. Her name, Alicia Williams. She had a 14-year-old son, and she too was undergoing elective plastic surgery in the Dominican Republic. She developed blood clots. She had a 14-year-old son. Another woman with a 14-year-old son came from New York City, the New York City area, New Rochelle. Her name, Alexandra Medina. We just did a story about her shortly after July 4th. That's when she had checked in to have a tummy tuck. She had saved a long time to have the procedure. As I mentioned, she too had a 14-year-old son, and apparently she developed a pulmonary embolism problem, and she died. Her mother, obviously her family, grief-stricken over this. I have a doctor, a plastic surgeon from New York City joining us tonight. His name, Dr. Elie Levine, and I know you're hearing a lot about this, and you've probably warned people about this for some time. Why are we seeing this pattern of deaths?
So there's a lot of draw towards having surgery out of the country. It's an opportunity to do inexpensive plastic surgery. The idea, the allure of having a vacation kind of thrown into it is very attractive. But unfortunately, the quality control that we really regulate in the United States is just not there consistently, and it really opens up significant risks for people.
And before we talk about it more, before we talk about the consultations that don't happen and people just flying in, before we do that, let's talk about the Manuel Nunez case. We have a little piece that was done by my colleague, Christian Benavides. He met the family.
Friends of 28-year-old Manuel Jose Nunez say he just had a way of making those around him smile.
The life of the party, pretty much.
He died after a liposuction procedure in the Dominican Republic inside of the Caribbean Plastic Surgery Clinic in Santo Domingo. I asked him not to do it, his heartbroken mother said. Norca Rodriguez was one of Nunez's closest friends. She was on FaceTime with other friends who were inside of the recovery area of the clinic and was able to see Nunez over the phone after the surgery. They said it was normal for him to look like he's not breathing, Rodriguez said of the nurses at the clinic. Jonathan Bahana was in the room when Rodriguez got the video call.
He didn't look so healthy. He didn't look well as well. He wasn't responding to any of them two voices.
It soon became clear that Nunez had died. On social media, the medical center advertises to clientele from the United States. This ad from 2018 says in Spanish, "We will pay your airfare and 7 days in a recovery home," adding that the promotion only applies to United States residents. The Dominican newspaper El Caribe has identified the doctor who performed the procedure as Dr. Oscar Polanco, who is a gynecologist and not a plastic surgeon.
As a plastic surgeon, you must think that's outrageous that a gynecologist would be performing these surgeries.
It's the amount of plastic surgery training after medical school. I did 7 years of plastic surgery training, so there is a lot that goes into that training. So understandably, it is a bit surprising when someone without that expertise is trying to perform procedures on people.
And they call it medical tourism. People simply fly in and almost immediately they're on the table. And that's not what you do in New York.
No, I mean, I'm spending at least an hour with patients in the initial consultation, and then everyone is going through a thorough medical evaluation to make sure that they're medically sound for the procedure. And all of those things really need to come together in order for someone to proceed with surgery. And unfortunately, the attraction of flying someone in and immediately taking them to the operating room really opens people up to significant risks.
And it's not just about certification. I'm reading about things like the water supply. Tell me about why that's important.
So there's so many little details. The surgeon is one of the things that we focused on, but that's only part of the equation. The facility, everything from how sterile is the equipment, how clean is the water supply, how well trained are the staff in order to recover patients properly, how well skilled are the anesthesiologists and their background, and the combination of all of those things really play a significant role in someone having a seamless process after.
A lot of people are watching and writing comments. Valerie Manietas, what a shame, your body is your temple. Leave it the way God made you. Stop going to these kinds of doctors, another person wrote. Someone saying they used to work for one of the doctors. Some people don't see it that way. They want quick and cheap. Unfortunately, going to the bank with their money, but they may end up dead. So, a lot of people are interested in this topic because a lot of people talk about getting plastic surgery. Let me talk about one of the victims, Alexandra Medina, one of the more recent cases, the mother from New Rochelle. She apparently had a pulmonary embolism. What does that mean?
So a pulmonary embolism is when there's a block essentially in the way to bring oxygen to your body. And the block could be a blood clot, it could be fat, it could be a combination of different things. And so when someone dies of a pulmonary embolism after an abdominoplasty, it could be anything from them not being the right patient for the procedure in the first place because they had something that would predispose them to problems. They may be more at risk for it because they're significantly overweight or they have smoking issues or other things. And in addition, it may be the technique that was used, that if there's the addition of fat transfer involved with the procedure where the surgeon can mistakenly place fat into the wrong area and can create a pulmonary embolism.
That can get in the bloodstream or something. And another person is writing, Cisco, Malachi, Freeman, most people that go overseas, whether it be Colombia, the Dominican Republic, etc., they go there to save an average of $3,000, $3K. It's not worth my life, this woman's writing.
Well,
Cisco.
it's such a great point because I would say that about once a month, a patient will come in and will ask about surgery in the United States versus abroad. And really what I really focus on is there's certain times in life where we're willing to take small risks. For example, if you're buying something online for $20, where if you can't even return it, say you've committed $20, it's not a big loss. But when you're dealing with your body, there really is no second chance and there's no opportunity necessarily to fix these situations. And so that really isn't the time to gamble.
I want to bring up a point from one of our viewers watching, Jay Rodriguez. He said, whatever God didn't give wasn't meant for me. It's not about DR, meaning Dominican Republic. It's anywhere. The last case she had to do, there were so many signs. So save it. No one forces anyone. Colombia, DR, Miami. Plastic surgery deaths are everywhere, so stop trashing DR. And there's a hashtag Proud Dominican, and that's true. Plastic surgery deaths do happen everywhere.
It's not about the Dominican Republic. There have been unfortunate events in other countries and other places, and the truth of the matter is, even in the United States, it's not without risk. But it's really about doing your due diligence beforehand to try to limit the possibility of these things.
Right. Then Manuel, who was one of the victims from June, the one who was the waiter in New York City, he developed respiratory distress. So that's sort of a common thing that can happen during surgery.
Well, it can, but if someone is significantly overweight or has some sort of underlying cardiac issues, or the procedure that's performed is too large or too significant for them, or the right amount of fluids were not administered before, during, or after the procedure, they can predispose someone to having catastrophic consequences that can be avoided if all of those other things are done properly.
It's not just an issue with the surgeons in the Dominican Republic, which a warning was issued about that nation a couple of years ago. It's not just the Dominican Republic. There are these recovery houses, and some of them are in Colombia, South America, and there are major advertisements for them as well, and there are risks associated with some of them. I did an investigative piece a while back, about 2 years ago, involving a woman from Brooklyn who went to one of these houses. Let me play that story and we can discuss that.
Because I lost a lot of weight. My son saw me and said, Mom, you lost a lot of weight.
Aura Shamam was still wincing in pain nearly 3 weeks after she went to Colombia for plastic surgery.
Breast lift plus implant, liposuction, and Brazilian butt lift, BBL.
The mother of four had a facelift in New York a year and a half ago, but for $7,600, she'd get 3 procedures in Cali. She remembers the recovery room being packed.
You see so many bed, and everybody's screaming.
But Shamam is more upset about the recovery house in Cali, advertised by a young Queens woman named Momo Sofly on Instagram. It's called Sophistique Solutions. Aura's roommate in the house was Marcel Davis, who FaceTimed us from Texas.
We were drugged.
And why do you think they were drugging you?
Because they wanted to take advantage of us.
Shamam said she was missing $500 after her first night at the recovery house. Momo's mother, Ziamara, who runs the house in Cali, denied any money was taken.
Look at her face. She's smiling.
Shamam said she paid $1,600 for 16 nights. She made the deal with Momo's mother by text and says a red flag popped up when Ziamara advised her about dealing with customs at the Cali airport.
She told me, when you're coming, just say that you're going to visit a friend.
The lady at the house that we stayed in, she gave us a fake address.
Shamam and Davis said the house they were taken to wasn't even a house. It was more like a small unit in a housing project.
The window was covered with the black things.
Then Davis had a bad reaction to her surgery.
I was unconscious. I was blacking out.
They said a Brooklyn-born businessman, Fitz Gurna, rescued them and took them to a recovery house that he runs in Cali.
They looked like they wasn't eating.
I never thought I would see them. I never thought I'm going to see my children again.
Would you do plastic surgery again?
Never. No. I'm done.
Well, I spoke to Aura Shamam this evening, and she said 2 years later, she still has problems with lifting things, and there are still complications.
And some of these things can be fixed, but not all of them can, unfortunately.
What are the things that you're asked to fix?
So it's usually a combination of scars that are very poorly healed, and it almost appears that the procedures performed very quickly. Mm-hmm. Breast surgery often has issues relating to either probably unaccredited, uncontrolled implants where you have no idea where their source is, meaning they could have been used in someone else previously. You don't really know whether they're safe implants, and they have all kinds of issues relating to pain as well as cosmetic problems. And then when you're doing things like Brazilian butt lifts, BBLs, and
why
fat
are they so
transfer,
popular?
Curves are a good thing. And so people like curves, understandably, and curves can be narrowing the waistline, and it can be rounding out your backside, and the world that we're in and the social media that we see mm-hmm. encourages that. But even the products that are used or the techniques used can create a lot of scar tissue and problems for people.
Yeah, I have some comments here, some more from the viewers. Melissa Castro, I think all of this can be avoided with healthy eating and working out. Don't get into the habit of becoming lazy and looking for an easy way out.
Right. A lot of these comments are fair points, but at the same time, there are certain people, due to their genetics, or they've had multiple children, or just the way they were born with different things, a bump on their nose, a small chin, that they can't necessarily fix them that easily. And a lot of people have a lot of self-confidence no matter what they look like, but other people, it really impacts them. I had a patient who came in today who I did a 45-minute procedure on a few weeks ago where he put in a very small chin implant, and it's one of those subtle differences. And at 2 weeks, she looks great, and she said to me, I walk around with so much more confidence now. And those are those elements of procedures like that don't necessarily make you live longer or keep you healthier, but their quality of life is so much better. And so it's great if we're 100% comfortable in where we are, but not everyone is, unfortunately.
I just want to read another comment that's important because I want to be fair to everyone, to the viewers. Anna Ortiz is saying, but your headline reads, the Dominican Republic, basically singing it out like this is the only place where this happens. All doctors and clinics are not bad, and we certainly recognize that. The only reason it said Dominican Republic in the headline is that that's where the 3 recent deaths happened that have made headlines.
She brings up a great point, because even when patients come in and ask me about surgery abroad, my response to them is very consistent. It's generally that there are some outstanding providers outside of the United States, and there are some people that aren't even accredited or trained physicians performing procedures. And the problem is it's hard to discern who's who. And that's one of those things where you go to a plastic surgeon in the United States and you can see if they're certified by the American Board of Plastic Surgery and whether they're members of the American Society of Plastic Surgery. And you can get that information and understand that they really do have the proper training to do something. Unfortunately, out of the United States, it's not that easy. And so you can walk into one place and get an outstanding result at a significant discount and walk in somewhere else, and unfortunately a disaster can occur, and there's no really way to know with certainty where you're walking into. And it has nothing to do with one particular place. It really holds true of everywhere outside of the United States that
Yeah,
we're really
and
talking
basically
about.
our headline was just related to the 3 deaths that
Sure.
just happened in the last month, and that's why we had the conversation. But Giovanka Fernandez is writing, yes, please stop talking about Dominican Republic. My daughter almost died in Miami, which is in the United States, after plastic surgery. We have plastic surgery in DR, and there were no complications with us. My daughter traveled to Miami, and she almost died. So, we have to certainly point out that it can happen anywhere.
Sure.
But I do want to also bring up the teacher from Alabama because she had blood clots develop. And I just want you to sort of talk about why that could have happened during the
So-
surgery.
So blood clots can develop if someone has a predisposition to them, and that can be a genetic predisposition. It can be relating to maybe they smoke, maybe they're significantly overweight, maybe they in general live a very kind of sedentary lifestyle, and that can predispose them to it. But also in the operating room, before starting a procedure, generally a surgeon should apply compression stockings to a patient to make sure that they're getting continuous circulation throughout the case. Maybe that wasn't performed. Patients need to be mobilizing and moving pretty early on, right after surgery, again, to prevent blood clots. And if they're kept sedated or drugged or kept in a state where they're not moving around, that predisposes them as well. And so there are a lot of things that need to be done beforehand, during surgery, as well as after surgery to prevent blood clots. And while they can happen anywhere and everywhere in any procedure, whether we're talking about cosmetic or in general, it's about trying to limit the risks of that.
Right. I mean, so many factors to consider. Doctor, you're a wealth of knowledge, and I really appreciate you coming in this evening to Pix 11 Facebook Live. Before we wrap up tonight, I want to say a huge thank you to our producer of the last year and a half, Andrea Cavalier. We have a beautiful photo of her from when she won an Emmy Award this year with our social media team. We were so proud that night. Andrea has been working with me since the Mary Murphy Files started in February of 2018. I want her to come out a quick second. She is going to Dateline. So certainly she deserves this opportunity, and I want to thank her for all her hard work. Andrea, give me a hug. Thank you.
Thank you.
We worked on the junior case together from the
Yes,
beginning.
from the beginning.
And then Andrea was there on the trial when the verdict came in. Just has done tremendous work. And from North Carolina,
Yes.
proud and true.
Yes,
Say
yes,
hi to all
definitely.
your
Hi.
family in North
Hi,
Carolina,
everyone.
your friends, and I'm sure they're very proud of you.
Yes.
And we're proud of you.
Thank you.
And wish you good luck and all the best at Dateline.
Thank
you have
you
a
so
big
much.
future ahead of you.
I'm definitely going to miss you and miss everyone here.
I'm going to miss you because you were great.
Thank you.
in
We've done a
terms
lot of good stuff.
We did a lot of good work that we're proud of. The El Chapo verdict, there's,
Yes.
there's a lot. We've covered a lot
There's
of
a lot.
history in
Yes.
just a year and a half.
Yes, we have.
So thank
Yes.
you,
Thank
Andrea,
you
so
so
much.
Yes, thank you.
And we have to, she's going back to the
Back.
computer now. Dr. Elie Levine, thank you so much for being here.
Thank you
I
for
mean,
having
you
me.
really put a lot of perspective on things and helped us to understand some of the medical complications that happened for some of these patients. And thank you for your time this evening. I thank the viewers for being here and for all your comments, and hope you'll be here next week for the next Mary Murphy Files without Andrea, but we'll have a new producer, and I wish you all the best, Andrea. Good night.